I'm hoping that as we become more knowledgeable about the biological, genetic, and family systems and social network, all the things around mental health, that becomes less of an issue in 10 years. And although it's still always going to be a part of our practice because disease is disease, that it is less of a profound part of our practice. I do think there will be 10 years might be a little bit of a short timeline, but I do think that we will see more very personalized medicine, people having adults and children alike, having more understanding of how medications interact specifically with their metabolic personhood. And we already can do some of that with regard to mental health medications, especially SSRIs with pharmacogenetics. But I suspect we'll have even a better understanding of all that. I think the gut microbiome is going to become a major player in the way we manage infant colic and the way we manage eczema and food allergy prevention from starting from birth and moving forward. I think it's going to become a much bigger player in medical management going forward. And our understanding of it will become much more nuanced. It won't just be when things are out of whack, but it'll be a more proactive approach in our health understanding.
I think the microbiome is going to be fascinating, not only in mental health, but metabolic disease, obesity, type 2 diabetes, allergic conditions.
Yeah,
I think we're not even seeing the iceberg. We're just seeing the little
I
tippy
agree.
top.
I agree. And
Nobody's
looking at
going
the
down.
data around
Yeah.
colic and the gut microbiome is fascinating, actually. Looking at babies who are colicky at 6 weeks and looking at the adjustments and reduction in symptoms, and it's interesting just to see. So I think there is quite a bit we still have to learn. Looking at the reduction in food intolerances and allergy predilections, I think there's a lot there. I think there's a lot there. And then if we look at mental health in particular, kids who have high processed food diets are more at risk for mental health conditions like depression and anxiety. And of course, it's hard to weed out confounding variables. Of course, kids who have high processed diets are probably also in households that are a bit more stressful. They may be a little bit more chaotic, or their parents might be a little bit more permissive because of the nature. If you're having that diet, who knows? But I also think that creates a gut microbiome that's different as well. And how does that all play in? We have to think about it in a variety of ways, but I do wonder about its role in promoting mental health.
And then I have one last final question because we've taken a lot of your time today, but how do you think the lack of payment, and when I say pediatricians, I'm using that as a very broad word because we're a community. I can't be good at nutrition. I can't do cognitive behavioral therapy. I can treat some type 2D patients, but I can't really treat type 1D that's already in stage 3 that needs insulin. So I need a community that I can hand off or ask for support in some of these patients. And the community as a whole is not being paid to do the work they need to do. How do you think that has a negative impact? And it's no longer the Medicaid patients. It's also true of the commercially insured patients. Some of these plans pay worse than Medicaid in some markets. And you cannot get the help that these children need because there's no one that can afford to stay.
I think that we're going to come to a reckoning in primary care as a whole. Pediatricians, of course, are at the lowest rung financially on that ladder of primary care, but we are not alone in our frustration with payment for the services we give.